So Dan, is it better to have more data or less data to focus in on a smaller amount of data, or is it better to have significant data sets
Yeah,
to work with?
I'm asked that question all the time. I run a company, Verontos, that does high validity real world evidence. And customers say to me, can't I just get more data and it'll be more accurate? And that's not the case. If you're using low quality data, doubling the amount of data or taking it by 100x does not give you a different answer. It does not give you a better answer. The key is to use high quality data, whether it's a small amount or a large amount, and power it sufficiently for the assertion you're trying to make.
So how do you get higher quality data?
Well, that's the trick. We have a belief of how to do it. We're currently under a study with FDA sponsoring that's looking at this specific approach. And the approach is take from the EHR the phenotype, meaning the information about the patient that says these diseases, these subtypes, you get from the EHR. Since the source of truth in the EHR is the unstructured data, the narrative the doctor writes, you have to work with that. Use NLP and inference technologies to pull out the information. And then, like we do everything everywhere else in healthcare, check the accuracy. Create a sample that has a gold standard and check that you've achieved high accuracy. This is the step almost no one does, but we do it everywhere else in healthcare, is we check to make sure what we did worked. That's part of it. And then the other part is outcomes, where you link to claims and registries to understand how the patient did. Knowing the subgroup from the EHR phenotype and the outcomes from the claims, you can actually make an assertion as to what's happening. But the key is to get a really high validity phenotype to know the accurate description of the patient. And that's the hardest part of this.
So who is using this kind of high validity data today in the administering of care?
Right. So everyone is using a little bit of real world evidence right now. In terms of high validity real world evidence, we're seeing some come out in oncology. You're seeing us do some in a few areas like cardiovascular and neuroscience and inflammatory. You're seeing a few groups put out high validity real world evidence. But remember, 21st Century Cures was just passed in December of 2016. And the FDA's guidance is not even out yet on real world evidence. We hope it'll be out this year. This is the beginning of an effort, not the end of an effort. So it's just the beginnings of using this information.
My audience is going to be a fair number of healthcare providers and people in IT departments across the country, predominantly in the US. What can they do to enable this progress or be ready for this as this comes to their health system?
Well, I think the first thing to do is know good from bad. If we are indeed going to feed information back to the health systems and say this subgroup should be treated in this way, you can find this subgroup for pop health or disease management. Here are the ways to look at subgroups. If we're feeding the information back, they need to know good from bad. They need to actually think about high validity and accuracy. The second thing they can do if they want to be part of the future is work with some of the companies that are running high validity studies. We have engagements with some of the largest health systems. And as part of our engagement, we are teaching how to safely move sensitive data, how to extract it in a high validity way, how to feed the information back into the health system. We're happy to do that work. If a health system wants to work with us, they can feel free to go onto the Verontos website and reach out to us. We don't mind doing the engagement. We don't mind teaching what we know. We think that's important for the industry. And there are always plenty of studies that are being done. We're doing studies right now under National Science Foundation and FDA. We're doing studies. We just announced a partnership with Amgen. We have other firms we work with. There are always lots of studies to use as test beds so that health systems can learn.